Good evening, everyone. I'm AnnMarie Cronin. I'll be hosting a special live broadcast tonight on 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is here tonight to talk about how to avoid heart attack and stroke altogether, and what you need to do to prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls, so please make a note of this number, 800-859-0957. We'll be repeating it throughout the show, and this is your chance to ask your questions directly to the doctor, so stay tuned. We'll be right back. You're listening to 760 WJR.
Okay, we should be on Facebook Live.
Probably not the right time to talk about house cleaning business, but I just thought of some things, and from earlier in the minute, if I think of something, I better say it. Some ads still mention listing on Sunday.
Those are ads, yeah, because they're still our show.
Okay.
Whoever is on is under our auspices. I already had that discussion with WJR this morning.
Got it. Okay.
It's
Part of
like
the empire.
we
right.
are the prevention empire, and whoever else comes in is coming in by invitation. So I think about these things. This
Good.
is
Well,
not.
I'm glad to learn about this stuff after it happens.
Well, you don't need to know. You're just the voice
Right,
of
I'm
the
just,
specialist of.
I'm on the need to know basis.
Right, exactly.
That's how I prefer to be. My life is much simpler if I only need to know what I need to know.
Exactly. But it's all about prevention, though. I mean,
Right.
that's the point. I mean, whoever is coming on the show, whoever is going to be, I mean, we're going to be remarkably famous leading medicine in what we do, because it's all about prevention. And, you know, not to mention our magazine, but I was looking at the Top Docs issue today, and it's interesting how many subcategories of, you know, totally ridiculous subcategories of medicine are in there. And there's nothing for prevention. Isn't that unbelievable?
Well, it doesn't exist in
Well, yes, it
traditional
does.
medicine. Well,
It
does.
exists for you.
It exists for me, but it doesn't exist in traditional practice because there's no diagnosis codes, there's no billing codes, there's no way for people
That's
to
a
get
problem.
paid when they're practicing prevention. So
Right.
it doesn't exist as a standalone.
I'm going to talk about this when I come back.
Okay, 10 seconds.
I'm going to talk about this.
Okay.
Again, I'd like to welcome all of you to a special medical show here on 760 WJR. I'm AnnMarie Cronin, and we are here tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, as always, it's a privilege to have you on the show, talking to the audience about something that is crucially important, and that is the category in medicine of prevention. I happen to be looking at a very respected publication that I happen to write for as well, our magazine, and I noticed in the Top Docs issue, they have categories of all kinds of specialties and nothing about prevention. It's all about treatment, but nothing about prevention. And maybe that's because we don't have enough doctors that are practicing it. But let's tell the listeners tonight why prevention as a category is, definitely a specialty in medicine, is crucially, life-savingly important.
Well, AnnMarie, thanks. The reason there's no prevention category in the Our Top Docs issue is because there isn't such a thing as prevention subspecialty. You know, our healthcare is not here to stop you from having a disease. It's there to treat a disease that you have. And it's inherent within the nature of insurance. Insurance isn't there to stop you from having a problem. It's there to fix a problem when you have it. It's just like your car. They don't pay for your oil change or your new tires or rotating your tires or, putting in the windshield washer. They pay when you get an accident or your engine breaks down, again, depending if it's wear or tear or not. So healthcare is no different. It doesn't pay for you not to get something. It only pays when you have something. So it defies the definition of prevention to stop something before it happens. They only pay for it once you have a diagnosis. And the key to the concept of prevention is really just the definition of the disease. So in my practice, we define the disease at a much earlier state than it would ever be identified in a traditional practice. And so we're finding it earlier, we're taking it seriously earlier, and in doing so, and we can stop somebody from progressing to the actual condition that would be covered because you're never going to get it. If we find it earlier and address it earlier, you can actually stop from having heart disease. You can stop a patient from having diabetes if you find it early enough and address it aggressively.
I mean, it's pretty amazing that in this country we have the technology, we have the research, we have the studies, we have everything that we need to prevent diabetes, heart attack, stroke. We talk about it all the time on the show. And it's really kind of sad to think about. There is no real specialty that exists of prevention because all the doctors are in subspecialties or they're in PCPs where it's all about diagnosing you after you get the disease as opposed to figuring out how we can stop you from getting the disease. That and another thing that I came across today when I was in a specialty practice was some of the PAs and the adjunct medical people that were in the office had never heard of a concierge practice. We're talking about an office in Birmingham. So I was kind of surprised that still there are people who are even working in the medical industry that don't understand what a concierge practice is and why it's so crucially valuable to have access to your doctor 24/7.
Well, these days, because healthcare is a population model, and what that means is doctors are reimbursed by the number of people they see. And I remember talking to other doctors about what I do, and I'm talking about the quality and the time that I have. And back in the day when I did have a traditional practice, I looked at I talked about my practice about how much money I made in a month, but now they talk about it in terms of how many patients they see in a week and how many patients they see in a month. And that's their driver. That's their marker of success is how many people go in and out the door. And the higher that number, the better you're doing because you're essentially being paid as a doctor, in one way or another. But the reality is it's based on the number of people going in and out. We say it's like a conveyor belt. Patients have turned into widgets. You're just a manufacturing tool. You're a manufacturing product that's being measured in manufacturing terms. Well, I can get 150 widgets out in a week, or I can get 450 widgets out in a month. And that's how doctors are talking about you, not as humans or people, but as an item that goes in and out the door, and how many of those go in and out the door in a week and in a month, and that's a widget count.
Sad to think that we have pediatricians who are treating, young children and they're getting the child from birth up until 18 years old, and then they set them free, and then they're on their own to find a primary care physician, and they jump into whoever is local to be their primary care physician who's literally doing nothing about prevention. And then they move through that practice until they eventually get the disease, which is really pathetic.
Well, we did talk about concierge for a second. We kind of jumped away. So we need to talk next segment about why it's important. What does it mean to have a concierge doctor? Why it's important. And then we're going to talk about diabetes as a great opportunity for prevention.
Absolutely. Let's define those subjects when we come back. Okay, we're going to have to take a quick break. Again, you're listening to our weekly live medical radio show where we keep you up to date on all medical solutions from dealing with COVID to avoiding catastrophic disease. We are here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you would like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. You're listening to 760 WJR.
I think we need to remind the listeners that this, even though you just did, I think they need a little more clarity that this is a call-in show.
Okay.
I can do it because we're not normally on Tuesday and they're not used to this, and kind of go, hey, this is a call-in show. You're allowed to call and ask questions.
All the Tuesday shows are live.
Well,
but it's your show tonight.
It might be
no,
it's
good.
Listening.
No, you're right. You're absolutely right. Who knows? I mean, it's
a new audience.
Right. It's a new audience. Yeah. You're absolutely right.
I wonder with prevention, does it come down like specialties to, I feel like it happens way back in medical school, because you go to medical school and then you decide where you want to do your residency or your fellowship. I mean, the specialties are determined by where you do that sort of training and board certification, right?
Well, you choose it. You choose that specialty. And, I tell people, ask me, like, what do you practice? I tell them I'm making up my own specialty. I made up the specialty of prevention. Sometimes I call it arteriology. So I make up, I say I made up my own specialty. No one's doing what I do. I'm making it up. And, so they go into that, and the whole system's about identifying a pharmaceutical product to treat something. Granted, the pharma companies and the FDA are looking for earlier opportunities to treat, but the challenge is they don't lower the threshold for diagnosis until a pharmaceutical agent comes across. So that's like the pharma product drives the diagnosis, not the other way around.
Right.
That's totally how this system operates. The pharma product drives the diagnosis. So if someone can make a pharma product that identifies diabetes and that treats a diabetic marker at an earlier age and has an outcome, well, all of a sudden they will lower the threshold for diagnosing diabetes. Instead of the FDA saying, we can do better, let's diagnose diabetes 20 years ahead of time. We should be doing this on the show. This is a good
No,
rant.
but what you were saying, before we went on the show is the new medication or treatment for Alzheimer's.
Yeah, but let's stay on the diabetes because it's more preventive, and and so it's a better way to go at this.
Okay. Welcome back to our special live weekly medical show on 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician in Birmingham, Michigan. As a recognized leader in the field of catastrophic disease prevention, including heart attack, stroke, diabetes, and many chronic conditions, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. Through advanced and more sophisticated diagnostic technology, we are now able to arrest and reverse the progress of these silent killers. We're inviting listeners to call in with your questions at 800-859-0957. Dr. Kolender, before the break, we were talking about defining for the listening audience, and we're not normally on Tuesday night. It's usually Thursday at 7. This week we got preempted. We're on Tuesday, but welcome all the Tuesday night listeners. But defining prevention and a concierge practice.
Well, the reason to go to a practice where there is concierge means you're paying a retainer fee to be in the practice. And the reason that's important in the world of prevention is insurance does not cover prevention. And so, like, for instance, let's take diabetes as an example. So, you cannot access a diabetic drug unless you have been diagnosed with diabetes. And in my practice, that's way too late. So I'm identifying the precursors of diabetes that can be happening to people 10, 15, 20 years ahead of the actual diagnosis. And I'm putting people on a program to stop that process and delay the onset of diabetes. And it's not really just about stopping that diagnosis, as you know, AnnMarie. It's about not having that process cause other chronic diseases, because that process is called insulin resistance.
Right.
So I'm identifying patients with insulin resistance when they walk in the door. It's very common. 4 out of 10 Americans have insulin resistance.
Why?
And
Why are 4 out of 10 Americans suffering from insulin resistance?
Because we live in a toxic environment. We're
Is it
eating
because of what they eat?
chemicals, we're eating sugars, we're eating, we don't exercise, where hormones are off balance. Our environment is terrible.
Well, let's take some calls because we're getting backed up here. Siobhan, you have a caller?
Yeah. So up first, we have Michelle in Clarkston on the line. Michelle, what's your question?
My question is, sorry to go back to COVID, but why did the doctors not look at all the new data that's coming out? I am actually, I'm 2.5 years, never had a vaccine. I think I had it at some point only because my husband had it, but I never had symptoms. I'm in my 60s and I still have antibodies. So I don't understand why doctors are still pushing that. And the second point was I had a doctor appointment, and of course everything's always good with me, but I asked about any preventative that Dr. Kolender always talks about,